In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
My guest in the studio today has saved many a marriage, probably, by helping the snorers, Dr. Thomas Penzel. Thank you very much for coming here today.
Hello, thank you for inviting me.
Dr. Penzel, you're an expert on sleeping disorders. From that point of view, what is the most common reason for snoring? What causes that obstruction in the airways?
Well, the main reason for snoring is the collapsible airway. The collapsible airway, which is typical for humans, and the nerves at a certain age don't work as proper as in young age.
Mm-hmm. So that's genetic, that our airways tend to collapse when we sleep, or the tissue vibrates then in the breath, basically. But there are other factors, I guess, that induce snoring. Many of our viewers have written in to ask about that. Like Alex Sika from France wants to know why he snores when he lies on his back and not when he lies on his side.
Yes, there are many reasons which aggravate snoring. So positional snoring, lying on the back, is indeed one of the aggravating factors. But not everyone snores when being on the back. Some people tend to snore in any body position, but others just on the back. And there are other reasons. Other reasons are obesity, fatty tissue, and smoking also. So there are a number of other factors too.
So those are factors that you can influence. You can lose weight, you can stop smoking to try and better your snoring. And we'll speak a bit more about other therapies later on. Let's focus on children now. Children sometimes snore. Is that something they'll just grow out of?
Oh yes, children also snore. That's very important. And parents can recognize that if the children fall asleep during daytime, if they don't perform at school as well, if they are tired. And their snoring is often a cause of big tonsils. And for that, it is important that investigations are done by an ENT physician looking at tonsils, and something can be done, definitely.
So you should get an ear, nose and throat doctor to look at that if your child snores. Snoring can also be a sign of a more serious underlying condition. Can you tell us a bit more about that?
Snoring is, in our medical terms, something like a precursor of sleep apnea. If the snoring, which is annoying for the bed partner mainly, and often snoring is a sleep disorder for the bed partner more than for the snorer, well, if the snoring becomes irregular and if the snoring is interrupted by breathing pauses, best observed by the bed partner, then it becomes dangerous. Those breathing pauses, they are typically 10 to 60 seconds each, and they may be repetitive, up to 300 breathing pauses during the night. We call this sleep apnea.
Mm-hmm. So in that case, you don't get enough oxygen, and that can cause serious problems, and you should get it checked out, right?
Yes, sleep apnea is a very important disorder with lots of consequences like sleepiness and hypertension.
Mm-hmm. Dr. Penzel, what would you say, when is surgery really the best option for a snorer?
Surgery is a good option if there are large tonsils and if there's a lot of floppy tissue. But in general, unfortunately, those surgical options, they are not very effective. Only in half of the patient it really helps, and they really improve the symptoms only by 50%. So it's a problem.
What other forms of treatment are there that you could try?
Well, we think that surgical options are third line. First line is definitely something like a ventilation therapy with a mask. We call this CPAP. Second is some tongue-based jaw advancement, so that can be done by a dentist. And only third may be an option of surgical options.
Mm-hmm. Well, there are many treatments out on the market or available. Let's go through them and see what's your view there, if they're effective or not. What about sleeping pillows, special pillows for snorers?
Yes, they are quite popular. Sleeping pillows or some vests in order to avoid the back position. They may help to reduce the noise and to some extent the snoring if the snoring is on the back side. But as not all people only snore on the back side, it's only effective in a few parts and a few people.
What about anti-snore spray? Does that help?
Well, anti-snore spray we actually evaluated some years ago and looked for the effects. It's some kind of moisturant in the upper airways and it seems to lower the noise a little bit, but it does not extinguish snoring at all.
And the nose straps, do they help?
The nose straps somehow make the nose wider, so there is some positive effect. We know this also from sports, from running people, that there is a more effective nose breathing. But for the snoring, which happens in the back of the throat, it doesn't help that much.
Okay. Well, what can give some hope to snorers? Is there anything that's being researched, any new methods out there that we can wait for or hope for?
Yes, we are still looking for new medications, for new drugs against snoring. And the one who will find that, he will become a millionaire, no doubt. Unfortunately, that has not been found. And we also look for new therapies for sleep apnea. There are kind of pacemakers which are implanted here and which help to protrude the tongue and by that open the upper airways. So some options on the horizon.
All right, well, let's wait for that and hope for that. Thank you for being our guest. Thanks for your time.
Thank you very much.